Hello and welcome to Youth in Sports, where every Tuesday night at 7:30 p.m. we feature special guests from near and far. The program is sponsored by ATI Physical Therapy, providing certified athletic trainers to more than 30 area high schools and colleges. First State Orthopedics, the team taking care of Delaware with a commitment to excellence. And Wilmington University, where Youth in Sports is produced by the College of Technology's students and faculty. And now, from the studio at President Jack Barcelona's Wilmington University, your hosts for Youth in Sports, AOSSM Mr. Sports Medicine 2012, Dr. Michael Axe, UD and St. Elizabeth's own Dr. Joseph Strait, and co-founder of Youth in Sports, Mr. Walter Laudine.
Hey, welcome to Youth in Sports. Dr. Michael Axe, team physician for the Wilmington University teams.
Hey, I'm Dr. Joseph Strait, and even though I'm losing right now in the First State Cup, I'm team physician of the Goldie Beacom.
And I'm his assistant.
Yeah, you are.
And he's my assistant. So we take care of both each other. But we thought it'd be fun tonight to have Doctors Talk, where we talk about, we take care of athletes from the little guys and little girls all the way up to the professionals. And what questions do we get at in the course of coming to the office? What are their concerns? And I just had clinic here at Wilmington University, which we do prior to the shooting every week. And I had one young man, basketball player, has pain in his foot. Dr. Strait, when you got a basketball player with pain in your foot, what comes to mind?
Oh, first thing, stress fractures. Stress fractures, stress fractures, stress fractures.
And what causes a stress fracture?
Just pounding on that foot just way too much. The running, the jumping, all the preseason running to get in shape, and then all the activity back and forth throughout.
But Doc, he says he got new shoes. Is it the shoes?
It's not the shoes. As much as they want to say, well, they think that shoes help them jump, but with the stress fractures, it has nothing to do with the shoes.
You know, one of the fun things about stress fractures, what do you get, and what is a stress fracture? Well, it's the inability to heal between insults. So that what Dr. Strait was referring to, the insults of running, jumping, and all those other things, they constantly put pressure. Now, what this young man had was he had a shaped foot. It was shaped kind of like a kidney bean. When you see the little toe side of your foot, it's shaped kind of like an arc. It puts all the force right at the base of the bone, not the ones you can see, but the ones you can't see in your arch, right at that very end of it. Now, I'm obviously using my hand to reflect that, but it's the same thing on the foot. So if it bends right there, it's likely to be a problem right there. Here's the issue. If you have an upperclassman or a senior and he only has a few games left, the treatment really doesn't change much. The architecture of his foot's been there the whole time. Why did it suddenly decide to be a problem? Because of probably the time in the season. You know, we've had more, where after the holidays now, they're playing more games, they have practice, they have other games, and they're more frequently happening with fewer breaks. With that said, we use a bone stimulator, Dr. Strait, that puts it on there. What that does is allow healing. At an x-ray at a week may not show it, because many times stress fractures won't show up for 8 to 10 days. So right now we treat it as if it might be by restricting activities, making the shoe more firm, using the bone stimulator.
And a lot of people out there that have had stress fractures or even foot fractures other than stress related, they wear hard-soled shoes that are real firm so that we can rest the area. Sometimes we use boots if it's to the point where they can't bear weight with pain.
And then the other thing, there are a couple stress fractures of the foot, though, you can't play with. This isn't one of them. So what do you see in clinic over at Goldie lately?
A lot of what we see is concussions now.
Talk about it. No, concussions. Basketball, you're seeing concussions?
We have had actually some weird injuries this year over at Goldie Beacom. We had a basketball player with a concussion who actually fell and hit her head against the ground.
Did you tell her not to dunk anymore?
Well, she's done that a couple times. Nah, I'm just kidding.
Yeah.
No, she. So at this point,
well, what do you do? What do you do over at Goldie? I know here at Wilmington we have a program. If one of our athletes gets a concussion, they're student athletes at both institutions, and we have a responsibility to take care of them before they go back to play. But we also have the responsibility to make sure that they're performing well in the classroom. So what do you do
We have a program set up. Actually, our athletic trainers have set up a program that has a evaluation of both their mental and educational abilities, and limiting their abilities to be in class and how long they're allowed to study and things like that, as well as the participation. And there's a program that progresses them back to play after their symptoms have resolved. And it takes approximately a week after the symptoms have resolved to actually get the player back to doing some normal things with our sports and stuff. But from an educational standpoint, sometimes they need extra time in the classroom or actually with exams. So we make sure that they are taken care of from the educational side.
I'm going to tell you a cute story. This is, I also take care of athletes that are back in school already, and some of them have winter session. So the question is if they have to have urgent elective surgery, but it could wait to a more optimum time. In other words, you have a window of a couple, 3 weeks to do it. When is the best time to have surgery? Well, I talked this young man into waiting until after he was in class for 2 weeks, so he knew what the responsibilities were going to be for the class, and that he could get ahead in the workload prior to his surgery. But I shared with it happened to be a him on this occasion, that he was not to take exams until he was sure that he could think properly, which is similar to the concussion part. You can't be reading the same paragraph 3 times and not comprehending what it is. You may be putting in the time, but you're not being very functional. And if you take an exam and then come to the doctor and say, well, you know what, I took an exam, I thought I was ready, and you don't do well in the exam, I can't help you.
It's hard for us to help.
We can't help. But on the other hand,
well, the other things that go along with that is the pain really does affect your ability to learn, as well as the pain medicines that we give with surgery. So, making sure that they're ready to take exams and things, especially in our college setting, we work really well with the school administrators to make sure that these kids are properly taken care of so that they can do well in their classes.
Because I can't help. If you take the test and didn't do well, I can just say, yes, you had surgery, yes, you're on medication, but now you're at the mercy of the faculty, and they have rules. And their rules are, if you take the test, you've taken the responsibility of taking the test, and they can't do anything about that. So that was one of the issues that we have had come up right now. Anything else different in yours?
Well, I want to talk about one of our athletes who actually was a golfer with a collarbone fracture.
Oh, I happen to know this story, but let's take down memory lane. Go ahead, talk about how he broke his collarbone.
So we had a golfer over at Goldie Beacom.
It doesn't matter where he went to school. He could have been in Wilmington.
Both very good programs.
Both very
good programs.
Yeah, they both could hit it long and straight.
He actually was in a tournament and was riding on a cart from one hole to another, and actually got thrown off the cart and fell on his shoulder and got up, had some shoulder pain, but decided he was going to try to hit the next tee shot, and boy, did that let him have a good time. So
yeah, we saw him shortly thereafter, and be doggone if he didn't have a collarbone injury. And we had a basketball player similarly. Now, we've talked a lot in the past, but let's just review how people hurt their collarbone. Well, they usually hurt it by falling on their side and somebody else or something falling on top of them. Causes the collarbone to break outward. That's a good thing because all the nerves and blood vessels are behind it. Usually there's no associated injury to the nerves or blood vessels, but it does hurt like crazy. Sometimes it rides up. We now know that for some of them we have to fix them, particularly if they overlap a lot or if they have an extra piece and they form a Z. Those have to be fixed. Also, we have them where there are ligaments that hold the bone down. That's what AC separation is the loss of these ligaments. If you break between the ligaments, they don't do well either. So there's a few collarbone fractures that may have to be fixed surgically, but for the most part, we can just let them heal. Now, those figure-of-8 straps that everyone has seen that are cruel and barbaric, you don't have to really wear those. They really don't make a whole lot of difference on most occasions, but a sling for comfort is good. And Dr. Straight, we have a couple of tricks on that with collarbone fractures. Sleep in a lazy boy chair so you're not all the way flat. And if you come to us, we're going to numb that area with some from Marcaine so it lasts 4 hours so you can go home and take a shower. Because if you don't, you're going to smell really ripe in about a week.
I think that the biggest thing that I see after collarbone fractures is the complaint of what it looks like.
Oh.
Usually the pain is not there, everything heals, and everybody has a little bump right at their fracture site, and they always want to know what can be done for it.
Well, nothing. You just let it go away. It helps to remodel over a year, but what you got a year is you usually have. We also talk about I always tell my parents, even the ones that don't look out of place, well, the ends of the bones actually grow away from each other and they'll start to move. And you'll hear it about it a week, they'll call up and they'll say the bone is moving. I tell my folks in advance that it's going to happen, because if you don't, you get a phone call. What else have you seen?
Let's move into some other fun areas that we see a lot of. Knees.
Knees, okay.
I think that's your biggest one.
Well, we had 2 knee-to-knee injuries. 2 knee-to-knee injuries seen in clinic today. 2 athletes bumped their kneecaps against each other. Hurts like crazy. Fortunately, it's more of a pain than an actual serious injury. It just hurts. How do you get tipped off if it's a serious injury in the knee? The knee will swell. And we have a grading, the swelling is called an effusion. We actually have a grading system within our way that we do things, so that I can communicate to Dr. Straight or to any other doctor in the country, and they'll know basically how much fluid is there compared to what there might be. We graded trace, 1+, 2+, and 3 looks like a balloon. Now obviously if you're a big person, a 1+ for a big person is going to be a lot more fluid than a 1+ for a little person. But nonetheless, how the knee functions is about the same. When you start to get to a 2+, it means that the muscles around the knee may not be functioning quite as well. And whatever they did activity-wise, if it were getting back into shape, you probably shouldn't go any more than that.
Let's get into what are the possibilities from a knee-to-knee injury.
Well, knee-to-knee injury, we're thinking kneecap most times. Sometimes in soccer, it's into the muscle on the big toe side of the knee called the VMO. And it'll swell up in a very big way, and it can be very limiting. What we like to do with most muscle injuries of the thigh and the calf is to make sure we maintain their full range of motion. Initially, though, we may put, for instance, a thigh injury, we'll bend them all the way up so that their foot almost touches their bottom. The reason being is it prevents the swelling from occurring. It stretches the muscle out over its entire length, and thereby it can't form a pocket of fluid for which to form. Because once swelling forms, it takes several days to get rid of it, and that's why we tape and do other things. We do whatever we can to compress an area so that it can't form that swelling.
Well, especially in younger kids with injuries to their quads and areas like that, we worry about myositis ossificans.
Well,
bone growth.
That's a funny condition in which these cells get so confused that they start to form bone instead of muscle. These are progenitor cells, they're healing cells, and it's a nightmare once it starts. So that's an occasion when we may put you on a special anti-inflammatory to actually prevent that from happening. And we see these things all the time. It isn't like it happens once in a while. Unfortunately, though, as you're well aware, early treatment dictates what's going to happen the next 3 to 4 weeks. So imagine you're in a season that's only 10 weeks long. You miss 4 weeks, you've missed 40%. And if you're a single sport athlete like way too many people are today, you've missed 40% of your season. That just isn't very nice. You've worked too hard for that. We're going to go to a break and come back and have more doctors talk with Dr. Joseph Straight of Goldie Beacon, Dr. Michael Axe of Wilmington University.
I will keep dancing on point, even if it hurts.
My arm is killing me. I don't know if I can pitch another ball. But I'll just play through the pain anyway.
I have to do the big stunts. To look better than the other cheerleaders, our tosses are bigger.
My elbow really aches, but I've got to keep practicing.
Don't tell them it hurts. They'll take you out of the game if you do. I have to push harder if I'm going to get a scholarship. I'm feeling dizzy, but I don't want to tell anyone.
Everyone's counting on me. I can't rest now.
Nearly 50% of all sports injuries sustained by middle and high school students are from overuse. Don't play through the pain. See your healthcare provider and follow their instructions for rest and recovery. Take the pledge. Become an advocate for sports safety. Visit stopsportsinjuries.org.
Go team!
Welcome back to Youth in Sports. Tonight is Doctor's Talk with Dr. Joseph Straight, Dr. Michael Axe. And Joe, we were talking on the break about we have athletes that are young and college age, but we also have athletes that are older.
Definitely.
Some of them older than us.
Weekend warriors, people who are still trying to play softball throughout their ages, all the way down to lots of runners. Lots of runners and bikers.
So we developed this concept called the soreness rules, and it can be used throughout all age group, but it is really important in our senior athletes. Soreness that, when we talk about soreness, we're talking about soreness that occurs with an activity. So the worst type of soreness is the soreness that occurs while you're doing it and it doesn't go away with warm-up. Whatever you've done to cause that to happen, you have to take some time off and cut back. Then there's the soreness that happens while you that goes away with warm-up. So you were sore, but you do your stretching exercises and it goes away. Well, for heaven's sakes, don't increase your activity more than you did the last time, or you're going to be in category number 1. Okay? Then you have the soreness that doesn't go away at all, and that's the one you need to come see us for. So if you've been smart about altering your activities and it just hasn't gone away, then we're going to be looking for things that are worrisome. And certainly we'll get back, we talked in segment 1 about stress fractures, but that's certainly a consideration that we have to have. So you should not run in pain, or you should not do any activity in pain. And if you're sore while you're doing it, that's probably not a good sign. If you're sore near a joint, that's a really bad sign.
Well, I think that's one of the biggest questions that our patients bring to us, especially the older athlete or even the non-athlete that comes in with pain.
The wannabe athlete?
Well, no, even just the older out of shape person.
How about the athlete that hasn't played basketball, was now playing in a pickup game for his the faculty game at the alumni game.
Yeah.
I sponsor all alumni games. They're guaranteed to be in the office on Monday.
But we always, I mean, we talk to patients, and their biggest question is what can I do and what can I do?
So how do you help them? How do you help them structure that?
I think off of the soreness, program, we look at that first, but also I try to look at what their diagnosis is and what hurts them the most, and try to structure a plan around that. So people that have patellofemoral syndrome or a lot of patellofemoral arthritis, which is behind your kneecap, we try to keep them out of as much flexion as we can. So I tell a lot of people who want to do squats all the way down to the ground to limit how far they're doing squats.
Who do you let do lunges?
Very little. In fact, I did allow someone to do them today because that's one of her favorite exercises to do, but I explained to her that she might want to go a little shorter on her strides when she's doing the lunge.
How about kickboxing and Zumba? Or Zumba? Unbelievably busyness over that particular thing. When I look back at what people have done, it almost always is these doggone January resolutions that they're going to get back in shape. So anybody who's been to the gym, and we encourage you to take first aid towels to the gym, but anybody who's been to the gym, and you cannot get a piece of equipment the first 3 weeks in January. Monday, Wednesday, Friday, you better find a different workout day. You better go Tuesday, Thursday, or Monday, Wednesday, Friday, Tuesday, Thursday, Saturday. Saturday morning, not a prayer. You better get there at the earliest time you can, because every piece of cardiovascular equipment is going to be in use.
I think that's why business for overuse injuries picks up around now.
It'll usually pick up usually the 3rd week. It usually takes 3 weeks. We're just about, this is a January taping. So we're about the 3rd week into anything, but it could be any time. It could be the summer when they also are making they're all in their April, May, June, when they're all going their diets and they want to get ready for swimming suit season. It's the same idea. It's 3 weeks after you begin to do something is when you really start to get the blues. Except the high school athlete, they get it on the 3rd day. The 3rd day blues. So what do you tell your folks? I had an individual, I'm going to give you the scenario of what I had to face, and you can give me what advice you would have given him. A senior of my age, so he's about 58, 59, and wants to continue on being very active because his social function is centered around running. And he realizes that he was unable to do so. His workup included x-rays, which revealed that he had significant arthritis in 2 areas of his knee, and also that he had swelling with that on clinical exam and tenderness on both sides. He felt that he really needed to run, that it was a critical aspect of him and he wanted of his life, and he wanted that opportunity to do that. I assured him that no matter what we do, unless we replace the joint, which would also limit his running, we can only slow down the symptoms. So that, and sometimes we go in there and surgically relieve those symptoms because we can take out some of the debris. And I did that. I went in and did that, and he's doing very well. He's feeling better. He has less pressure, but he also hasn't been running because he's in the post-operative course. So how would you take that individual and bring him back? Okay, so I handed him off to you because he's done with surgery, and you're helping him to do that. What would be your recommendations for him to move back into a more active lifestyle?
I think giving him an understanding that limiting his amount of miles is probably the most important thing that he can do.
Now, he wanted to do 4 days a week.
4 days a week, and what was his normal?
He wanted to do 3 miles 4 days a week. And I told him that I didn't think that was a reasonable thing. Okay? So what I suggested, in light of what you were talking about, is that you need 3 days rest. And this is kind of a rule that I work at. If you're 40 and under, I let you do what you want. Okay? But when you get to 40, I mandate at least 1 day's rest in between your workouts. So you can go Monday, Wednesday, Friday, but I do not recommend Monday, Tuesday, Thursday, Friday, or the like. When you get to 50, I recommend 2 days rest in between. So you can go Monday, Thursdays, okay? When you get to, and then you can do Sunday and then rotate your weeks as you see fit. When you get to 60 and over, I recommend 3 to 4 days rest. So I like those to be Monday and Friday, but that doesn't mean you can't do anything on Tuesday and Thursday or in between, because you can do things like, did you know that in neck-deep water you're only 10% body weight? And those reclining bikes, the ones you sit on and push out, 50% body weights, and the elliptical is 75% body weight. But when you walk on a treadmill, 1.5 times body weight. If you run on a treadmill, 3 times body weight. If you come down from a height, playing basketball, from a jump of at least 1.5 feet, you're up to 4 to 5 times body weight. So I ask you not to do those particular things.
I think exercise prescription in that guy's case would include getting him into more of an elliptical or a pool modification, and allow him to run 2 to 3 times a week at a shorter distance, but complement his exercise by getting him more cardiovascular for his heart and his lipids and all that stuff through other ways.
We talked about weight gain. The reason why everybody's trying to get back in shape is because they pick up 10 pounds usually between Thanksgiving and New Year's Day. The average American picks up 10 pounds. Obviously, the ladies tend to pick less, and some of us pick up a little bit more. But the goal is then to exercise to take off the weight. I caution you, 10-pound weight gain is 30 extra pounds of force on your knee. So I firmly believe in use the exercise to keep it off and use the diet to get it off. And if you're going to exercise, think about the pool or the bike or the elliptical where you're not jamming up your joints. Because if you think you're going to go out and walk and run, you're probably going to set yourself up for a problem.
I totally agree with you. And I think that's where, with most of my patients over the age of 50, I encourage them to do more of the less weight-bearing activities in the pools, exercise in the pools. Well, I really push yoga. Yoga is a great activity for stretching, flexibility. As we get older, we notice it decreases over time, and it really will help people for strengthening of their joints and flexibility around their joints to help with discomfort outside of using medications. So.
Yeah, I want to compliment Dr. Straight. If you've been watching the show, you'll say, well, Dr. Straight looks much thinner. That's because he is. Now, you've been watching your weight now for a good 2 months. Mm-hmm. Now, what has been your secret?
I think it's just learning how to eat properly.
But you're a doctor.
Yeah, most doctors don't eat properly. Trust me on that.
We get home late. We think it's an entitlement. Give me something, anything I can eat when I walk in the door. It's like, come on.
It is, and it starts from your medical school and your residency, and you're eating things at weird hours of the night, wrong times. You're definitely eating the wrong things, but I think what it is that people have to understand out there that there's other complementary foods to what they've been eating. And really what's helped me a lot is that I've cut back on a lot of, when people talk about Atkins, and that's a big high protein diet, it's not just the protein, but it's cutting back on the bad carbohydrates. You can still have carbohydrates. It's just knowing that eating your breads and your pastas sometimes, unless you need a lot of fuel for an activity like running or things, eating those can be stored as fat. And you know, that's what I've cut back on, and it's helped tremendously in the last few months.
And we've talked about this. I know that I can't go back into the gym and start lifting weights if I expect to lose weight, because I will elevate my muscle mass. And while orthopedics is a very physical profession, we have to know that that's what's going to happen. So my other recommendation is to get your weight off and then go back and tone. Expect to pick up another 5 pounds or so from your last, but you'll look better and you'll feel better. Your clothes will fit you about the same. Obviously, we men like our arms to look good. We don't want to be flabby in our chest. We like our guts to go away. The ladies are a little bit more oriented, the backs of their arms, the tops of their legs. They want to wear short pants. They want to wear shorter skirts. They want to feel comfortable in those things. And we have to approach those exercises differently based upon where you want to tone. But yoga, I've taken a few yoga classes, and I propose it because it makes a lot more sense than to go to physical therapy and have you exercise on your own. They give you a list of things to do, and they may show it to you. But in yoga, you have people in front of you doing it, or if you're so bold, you're the first person in front of the person that's actually leading the class. I'm all the way in the back. I want you to know I don't want anybody seeing me do my my different poses, because I think that while I haven't been photographed, I think that it would probably, I'd have to pay money to get them back.
Oh, definitely. Hopefully I get a set.
Have you been, wait, have you been to a yoga class? Have you been?
I have not, and this is hard to say for someone who does sports medicine in a medical field, but...
And you recommend, doctor, you recommend yoga and haven't done it?
I definitely do. No, but going even back to talking about weight loss, I mean, I have not been doing a lot of cardiovascular exercise, and you'll notice that once, like you said, going back to getting the weight off, my knees have always been a problem since childhood. I've had lots of knee pain, and getting the weight off has helped my knee pain, but also let me get back into exercising.
Well, we're going to go to a break, and we'll come back and talk about hyaluronic acid and how that may help you with your knee pain.
What does opportunity mean to you? At Wilmington University, it means providing a personalized educational experience where students learn anywhere at any time. Wilmington University provides a variety of ways to complete your degree. Choose the flexibility of online learning, or attend classes during the day, in the evening, or on weekends at locations throughout the region. It's your degree. Choose how you earn it. Personalized education, affordable tuition. That's the difference at Wilmington University. What does opportunity mean to you? At Wilmington University, it means finding an innovative degree program that fits your goals and prepares you for a successful career. It means finding a school that fits your life. We know the importance of providing individual attention, affordable tuition, and unparalleled flexibility in service. Because at Wilmington University, it's not about meeting your expectations, it's about exceeding them. Personalized education, affordable tuition, that's the difference at Wilmington University.
Welcome back to Youth in Sports, and it's Doctor Talk with Dr. Joseph Straight and Dr. Michael Axe. And we've been talking about a lot of different topics. We did the last segment, we talked about our senior workouts, in which I'm part of, and Dr. Straight hasn't quite made it yet. But one of the things we have ended with was hyaluronic acid. It's a lubricant that we put in knees and other joints, but mostly knees, to help them function better. We have noticed that by injecting these substances, which is a complex sugar molecule, either 1, 3, or 5 times over the course of a 1 week, 3 weeks, or 5-week period, that it offers 6 months of relief. One of the things that we've done, fortunately, I've been involved with hyaluronic acid for a lot of years, and I personally have given more than 35,000 injections, which puts it pretty, I don't know of a whole lot of people anywhere in the world who's done more than those. And the reason why I had to have that as part of my armamentarium was the type of patients that I take care of. They are not ready to be old. They want to continue to do things, and this was able to give them back their life. So what have I learned? So you people out there about hyaluronic acid, you can wait too long. In other words, if your knee's completely destroyed, I have 1 or 2 people each week that will be coming in for I call them grease injections, that I send right to my partners, Dr. Bodenstad and Dr. Racis or Dr. Johnson or whomever who does total joints in our office to have it. I said, you really aren't a candidate for hyaluronic acid. But I think you asked me earlier, Dr. Straight, well, how do I know whether it's going to work or not? And I find that if you get a cortisone shot and it helps you for 4 to 6 weeks, you stand a 75 to 80% likelihood that hyaluronic acid is going to work for you. If you get as much as 12 to 14, 16 weeks of relief from the cortisone, I stay with the cortisone.
I think it's one of the biggest things that's come on the market. I mean, since I've
it's been since you become a doctor.
That's exactly right, and I'm using more and more of it every week, and it's really helping even the middle-aged person who has early arthritis, even some mild to moderate arthritis, to get back to their activities. They're getting more active because the pain's down. It's been dramatic.
But it's not masking the pain. It's not Novocaine. You will swell if you do too much. You will have pain if you do too much. They just have less pain, and it's a really good thing. But you know, the other thing that we do, obviously Dr. Straight and I cover our teams, and we work in the same office, but we also are on the Medical Society's School Health Committee. And we thought we'd use this segment and the next segment to talk about some of the projects that we're working upon. I don't make as many of the meetings as Dr. Straight does because of other responsibilities, but you just had a meeting recently, and there's a new program that the Medical Society is rolling out with our new president, Dr. Stephen Kushner, who is my family physician.
So Dr. Kushner is programming, is kind of piloting this program right now, but he's put a program out for the Campaign for Kids. It's called the Obvious. It's Obvious.
And it stands for, the O is for obesity, the B is for bullying, the V is for vaccination, the I is for intelligence, the O is for opioid use, the U is for underage drinking, and the S is for suicide.
And he did this at a optimal time, actually, and what we're seeing is that over the past few years there's been increased rates of suicide in our high school kids, and he's directing this at this point at 9th and 10th grade students throughout the state of Delaware. He's going to start initially up in the Newcastle County area, and he's asked the School Health Committee to support and assist in making this program work throughout the schools. And
how's the proposed format?
It's starting off as a public forum lecture, actually, for both the students as well as the parents of the students, so that everybody can be educated on some of the topics. You know, it's starting off, I think, with, I believe the first topic is
obesity.
Obesity, I believe, is the first topic.
Yeah,
No, I'm wrong. It's suicide.
Oh, okay.
I'm sorry.
Well,
it is. It's suicide. The first topic is suicide, and it's actually coming up at the end of this month. And there's going to be talks every month on each topic. But also, he is looking to get into the schools. He's looking to get into, like I said, the high school levels.
Well, yeah, but he wants to be asked. So the health teachers, the administrators, or even the PTA meetings. It's a perfect format for a PTA meeting. The talk is to be about 25 to 30 minutes, and then an open forum for questions. So if you're looking for a speaker at your function, certainly we can try and arrange that through the School Health Committee of the Medical Society of Delaware.
Yeah, and it seguetails partially into what the Medical Society's School Health Committee is already doing with the Healthy Livings talk with the 7th graders in some of our middle schools.
Yeah, we've been talking about that. If you watch the show, Healthy Living is a program we give to 7th and 8th graders. And why did we choose 7th and 8th graders? Because of the information we're giving them is important to them while they're growing, while they're developing. The appropriate amount of calcium, not letting your weight get out of control, explaining to you the harmful effects of medications and the like, and some of the myths about
drugs and alcohol,
smoking,
and it touches on STDs and sexual activity. And
why? Because you have to get the vaccine before you become sexually active for you to avoid getting cancer of certain organs. So we have to do that before you start. It's a little late after you've already started. And we're hoping that by 7th and 8th grade, you haven't started yet. Our statistics show that as many as 25% already have.
That what Dr. Axe is talking about is the HPV vaccine, which is recommended for both boys and girls now prior to sexual activity, which is something that the state of Delaware as well as the CDC is encouraged.
How about our governor coming out with his standing on so many different things? He has been a huge advocate, and our Lieutenant Governor, Matt Dent, has really been an advocate, and he's going to be on the show in this block of times. I saw him at the inauguration, he and Governor Markell's inauguration, and he is looking forward to coming on Youth in Sports and talking about the programs that he wants to move forward. His wife is a University of Delaware UDPT grad. What else is going on in the program, though? What do you think? What do you think will be the highlight of this obvious program?
I think what it will do is to try to get some of these very touchy, I call them touchy, but situations and topics out to younger kids to see if we can make a impact on controlling some of the underage drinking, the suicide, and get out and maybe make others in the community aware that this is going on.
Well, one of the things that the governor has just signed in was his commitment to mental health. And many of these issues are centered around, do you like yourself and why not? And if you don't like yourself, you look for other reasons to like yourself, and if you can't find them, you result in trying to make it a more pleasant situation by losing yourself in drugs and other bad behaviors that you're going to wake up. And if you take too much, you may not wake up, and that's what the issues are all about. So you parents out there, I really think it's important that you get a handle on what the baseline is of your kids. You have to be responsible enough to know when they're not acting normal. You have to be involved in their lives without being so involved that they want to shut you out, and just know that between the ages of 13 and 15, you can't do anything right, okay? So you have to bear through those years and try to survive them as a family. But that doesn't mean because they're giving you a hard time that you have to say, and you can't be your friends. Let's talk about a topic that really gets to me, and that's the parent who thinks they have to allow alcohol at a high school party. Can you do anything more wrong than that, Dr. Straight?
I can't even talk to it because I never went to parties in high school and didn't consume alcohol, and my parents would never have allowed that to happen. So I never got to see it, but I do know that it goes on, and encouraging kids to drink early, especially at parties. I don't know if I'm against having a child who's around 18 drink in my presence where it's controlled and they get to learn how to use it correctly, but drinking at parties and what it's used for, it's kind of upsetting. The
Acts is a gospel according to Acts, and you're going to get one right now. I think that if you're old enough to serve in the armed forces, there's no reason why you can't have alcohol. If you're old enough to die, you're old enough to drink. But that said, that 17 and 18-year-old party that needs to have alcohol, I just can't see that. I think that you go away to college, that's a whole different story. You have to learn to be able to control yourself, and one of the growth phases is to know how much you consume and how much you can't consume. But I don't think you're a cool parent by allowing alcohol to be served at your home.
But I think that this program that's being put out there to get to the parents as well as the students is going to help to try to push some of those points that the parents can see that a lot of this is not helping their children in the long run. And
it's okay to have certain things that are no-nos. It doesn't mean you can't have events and parties and things like that. They don't have to have the heavy alcohol consumption that it takes to be drunk to have a good time. It does not. And the next day you do not feel well. It's not to say that we haven't all experienced that, but I don't feel that I missed a thing by not having that part of my high school career. Do I think that I may have overdid it a little bit on occasion in college? Absolutely. That's just the environment for which you have in college. But the one things we do know, that if you're caught in that situation, do not drive, do not drive, do not drive, okay? I think that's a very big point. I mean, that's with a lot of things, you'll notice that driving, alcohol with driving, texting with driving, speeding. I mean, we learned a lot. Well, we did learn about that. We learned a lot at the Orthopedic Symposium this year. One of our colleagues who's the head of the Orthopedic Society was instrumental in Oregon on many of the issues about driving and texting and so forth, and he found that speeding was the one thing that physicians love to do, because they're always getting from point A to point B. They'll eliminate the other things, but and it was the #1 cause of death. #1 cause of death. You know, but I think that this is where the Medical Society, as well as Dr. Kushner's program, and hopefully the parents can come out and support the programs that are out there and try to work on this with their children, you know? Yeah, I think that those... Starts at home. Yep, and you can find ways to have fun. You really can. Well, in summation, this is the Medical Society of Delaware Campaign for Kids. It's obvious, and we'll be back right after this for our 4th segment.
I know they never make me play with these guys, but why do they make me train like them?
Training hard is important, and for professional athletes, it's their job. But kids aren't professionals and shouldn't train at that level. Keep kids safe on the playing field and out of the operating room. Become an advocate for sports safety. Visit StopSportsInjuries.org.
Welcome back to Youth in Sports. This show tonight is on Doctor's Talk with Dr. Joseph Strait and Dr. Michael Axe. And in our last segment, we're going to talk about a timely topic, and that's gun control. The question was, what was the most significant injury that I've ever seen? And it was gun-related. This individual was in a deer stand, and he was hunting in a deer stand with his shotgun. The deer stand broke, for which he fell out of the deer stand. His gun went down and landed before him, and as he's falling down, it discharged into his thigh, breaking his leg. Okay? Now, that was a really significant injury for me to take care of, and it did pose a fair amount of problems. But it would have been perfectly fine because it wasn't, there weren't 20 rounds that were discharged at the same time because he didn't have a huge magazine. He had, unfortunately, 2 barrels, and they both were there. But what's your thoughts on gun control there, Dr. Strait, as it impacts us in the medical community? Because we're the ones that have to take care of these people that either make it or don't.
Mine was a little different. My biggest experience was when I was a 4th-year medical student doing a rotation at a hospital in inner-city Philly out on Broad Street. And I'd say multiple of these occasions, but the worst was probably gunshot wound that was a deliberate gunshot wound that actually went through the spinal cord and left someone quadriplegic, actually. And just to see how the family responds and how the rehab is, and just from, sheer violence and how it changed someone's life. And not even from the medical side, but from the emotional and the family side. And it was amazing.
So what do you think about the new rules, the proposal of the president to limit it to guns that can be effectively used for hunting? Okay? In other words, the traditional guns, not the big magazines, not the machine guns, the ones in which if you miss 2 times, the deer wins.
I'll tell you, I'm not a real big guns person anyway. I don't go shooting. I don't own my own guns. I have family members who do, and some officers that I know that own their own guns, and I think that they're used more for protection in that case. And I'm okay with hunting. These large clips kind of scare me. These automatic guns that are large clips, because why are we using them for protection in our houses and things?
Knowing the number of household accidents that occur is just
kids,
by having guns available. People lose their temper, and it's too easy if you have a gun in the household to use that gun before you have a chance to think. Or a young person, we all read each month about a young person finding the gun and discharging it because they didn't know that they knew it was loaded.
Exactly. The other things is people who purchase their own guns and register their guns are not usually the ones that are causing the problems with the guns. That's the other issue. So I think with the control over the guns, sometimes you're controlling people who would be using these.
Well, I encourage you to look at I am a Vice President Biden fan. I'll tell you that up front. Being a Delawarean, knowing him and his family for such a long time, and the proposal that he put forward for the president's consideration and what they've come out with, there isn't a single thing that I don't agree with. So I'm an advocate for all of those things, but I'm also an advocate for Ducks Unlimited and other people that are out there. You have to hunt or there will be too many ducks and there certainly will be too many deer. These are a necessary part of, if you want to have a reasonable control and everything to stay healthy, it has to be considered. So on one side, I totally support that. I support reasonable fishing as well. Because I like to fish and it's fun, and I want to catch some fish, so I don't want to be all fished out so that if I'm going to spend that exorbitant amount of money to rent a boat one day, that I'm going to catch some fish along the way.
You want something, right?
I
got
do.
to take something back and eat it.
Well, at least it's, I've never had a piece of fish that I've caught that I couldn't have bought for half the price at the fish store.
That what you spent on the trip, exactly.
But the memories are so good to go with that.
Yeah, I think a lot of people use that as a sport. I mean, we look at football and baseball and basketball, but a lot of people use guns like for hunting, rifles, as well as bow and arrow. It's a sport. So I mean, I think that those things need to still be out there. And
is there any changes in medicine, Dr. Strait, that you would like to see occur in your lifetime that you find that's really limiting in your ability to do things?
Yeah, I mean, not from a medical standpoint. I think more from a insurance and administrative standpoint. I think that coming out of medical school, you don't realize how, I don't want to use the word dictated, but the limitations that are put on physicians as well as patients, including insurance companies. I mean, there's a lot of limitations.
But what if I said to you that the insurance company does an analysis of MRIs ordered by primary care physicians, and they get a report back that 95% of them that were ordered have no significant findings? Isn't it responsible for them to say that you start putting requisites on before you order the test?
Definitely. I mean, I definitely think that is a necessity. Overuse of resources is happening.
And don't you think it's because the doctors today are test-oriented and they haven't been taught to put their hands on patients, that you can go into an office visit and have them never touch you?
You're exactly right. I think that the skills of physical exam have gone out the window. 30, 40 years ago, that's all you had.
Right.
So now, I also think that the medical legal system also has been a big push in getting MRIs on everybody, because you want to know
well, the
what's
patients demand it. They think that that's the procedure of choice to help them diagnose what's wrong with them, and therefore they demand an MRI. And I spend more time saying we're going to use an MRI if and when it's going to change how you think. In other words, if you want me to order an MRI to see if you're a surgical candidate, but you're not going to have surgery no matter what, then why would I order the test so I can order another test when you're ready to have the surgery done? It doesn't make any sense. I'm going to tell you something that's really profound, Dr. Strait. I think HMOs made me a better doctor, okay? And the reason why I say that is because they said that they wanted you to have reasons to order the tests that you order. That in the average teaching hospital, the cost from tests being ordered is 30 to 50% more than in a private hospital, just because they'll order a lot of things. So what it did is it made me think about why I was going to order a test, and I can share with you that most insurance companies are reasonable, and it's rare that we have to get on the phone and say, I want to order this because I've already put in my note, I'm ordering this test because, and this is how I'm going to use the test. And I know you do the same thing.
Well, I think that it has. It's actually encouraged doctors and pushed them to use their physical exam skills more to make a definitive answer and diagnosis before they order the test.
Well, you and I both know that we have to work from algorithms, that we have a treatment pattern based upon what we find on physical exam plus other diagnostic tests, which dictate where we're going to go in the treatment of a particular patient. And the reason why we can process people in a timely manner is because we've developed this, and Dr. Strait's is similar to mine because we've developed a lot of things together. He makes new additions when he thinks it needs to be done and tells me, hey, listen, there's a new test, there's something else that I think would be helpful in consideration, and then obviously it goes down and it looks like a tree. And we work from that. Now, some people put them in books. Ours tend to run in our minds, and we work from those particular things. And I don't know that I would have had the same need to do that had it not been for the insurance companies saying, why are you ordering that test when you're ordering it?
I think it's good. I think it's good for all doctors out there to have a treatment algorithm that suits the diagnosis, the findings, and it works right in their practice, and it helps them get to an endpoint. I mean, like you said, a lot of patients just want to know what's wrong, and doing an MRI doesn't just have to show them what's wrong. The exams can do that.
It correlates well, and I will use it if it changes the treatment or could change the treatment or impacts the treatment. Now, you and I have to make game time decisions a lot. So we had a scenario where we had a basketball player who developed a swollen knee, and we couldn't figure out, he didn't have anything ligamentous, but it was a new onset of swelling. And we wanted to know whether he could play or not, and the MRI would help us to decide whether he could play or not. And we in sports medicine tend to use these tests more for allowing us to know if it's safe for an individual to play or not, because we don't have time. If they miss 2 weeks, and it's a 10-week season, they've missed 20%. So we tend to be quick to order MRIs to help us with regards to dictating whether an athlete can return to play safely.
I also think that you see a lot of this in the professional levels, and I know, if anybody's been watching.
Now that is legally oriented too. That's the agent wanting to make sure that their gravy train isn't going to get hurt, because he gets paid regardless. He wants that 10% or 5%. Yes, and anybody who has been watching television of late in the playoff games, they saw Dr. James Andrews on the sidelines at the Washington Redskins game, and I'm proud to say that he was my mentor some 27 years ago, and that he's going to be working with my son next year when he's down in Birmingham as well. And it's only the second time that he's ever trained a father and son. And when he was out, when Jeremy was there at 2½, he has a crayon outfit that he went out trick-or-treating with one of Dr. Andrews' daughters, and I am sure that in some embarrassing moment in the future that crayon will pop up. Well, what's your last comment here on talking with the doctors, Dr. Straight? We're running out of time. My last comment is it goes back to the parents out there that watch our show and that their kids are in middle school and high school. And you got to be a big influence on your kids with all of these things: gun control, obesity, suicide and depression, knowing the signs and symptoms. And I believe that the Medical Society has put together a good program to be able to educate everyone out there, and I hope you guys all buy in. Yeah, I think it's important that you stay involved in your kids' lives, be in their high school, know their friends. It's okay to call and find out where they are that night. Thanks for watching. Youth in Sports, this was Doctors Talk.
What does opportunity mean to you? At Wilmington University, it means finding your relevance in the job market. That's why we offer career-oriented degree programs that meet employment needs in emerging fields. Dedicated professors bring their real-world experience into the classroom so you'll graduate with the tools you need to succeed on the job. It's your degree. Make it relevant to your career. Personalized education, affordable tuition, that's the difference at Wilmington University.
This show was sponsored by ATI, the company taking physical therapy to a higher level throughout the country. First State Orthopedics, where Youth in Sports hosts Drs. Straight and Axe are members of the team taking care of Delaware with a commitment to excellence. And President Jack Barcelona and his Wilmington University College of Technology, where each semester this student-run program is produced, directed, edited, and distributed under the guidance of the TV production faculty. Each guest receives a copy of the show, and all shows are available on the web at youthinsports.com.